What in the world is gastric bypass surgery? Well, what I'm going to try to do is break it down so you can understand what's going on, and then you'll be in a position to make a better informed decision. First, there is the stomach. And the stomach is a huge organ. Our first job with gastric bypass surgery is to reduce the size of the stomach where your food is going to go. So we take about 5 to 10% of your stomach and we turn it into a small pouch. In other words, we take 5 to 10% of your stomach and we leave that connected, and everything else never sees food again. That's number one. So what have we done when we've done that? We've actually made your stomach smaller so you can't eat as much. And when you do eat, and if you overeat, you're going to feel full, you're going to listen to your body, and you're not going to eat quite as much. And over time, what happens is that you lose weight. But that's not all of the story. There's more. The next thing we have to do is you have to understand that the small intestine actually is responsible for absorbing all these nutrients that you eat. So what we want to do is to decrease the number of nutrients or the amount of nutrients that are actually absorbed into your bloodstream. So how do we do that? Well, we have to bypass the normal route of intestines. In other words, we have to take some of your intestines out of the loop. In other words, the food never sees that part of the intestine. There's something called the jejunum and the ileum. And we actually go down, and these are part of your small intestines, and we divide that a certain distance away from your stomach. And once we divide it, then we can bring up the loop here and connect it to your new stomach. So now when you eat food, it goes into your new stomach, the small pouch. It goes into the shortened intestinal tract, and guess what? You can't eat as much, and you can't absorb as much, and then you start losing weight. So this is how we technically go about doing this, and once we're finished, we have to now reconnect the intestines farther down so that everything flows thoroughly. So we don't take anything out of your body, we leave you with what God gave you, but then we have a new pathway for your food that's shorter.